Joining us now is Dr. John Brownstein of Boston Children's Hospital. Dr. Brownstein, thank you so much for being here the day after Christmas. We are seeing case levels in some states that we haven't seen in months. How concerned are you about this Omicron wave?
You know, this is really concerning. We're seeing cases now surpass the Delta wave, averaging over 170,000 cases a day. I think we can all relate, given how many cases we're seeing around us. And while it's good news that this variant is less severe, just the sheer number of infections means that we have concerns about our hospital capacity. And we're already seeing overwhelmed EDs across the country. And we know this much transmission only furthers viral evolution. And that's why it's so important to double down on vaccinations, testing, masking, all the things that we know work to keep transmission down in the community.
And to that point about hospitals, the CDC guidelines now shortening the isolation times for some healthcare workers if they test positive. Do you think that that could help those hospitals that could be crushed with patients?
I think it will. We don't know the optimal isolation time for Omicron, but of course this change means that, our healthcare workers might not be stuck in isolation at a time when we need our hospitals to be functioning. These guidelines don't apply to the public. That might change in the future, but for now, we need our hospitals running to potentially deal with a surge in the coming weeks.
And Dr. Brownstein, you are a parent just like I am, so it is concerning for parents when you hear that pediatric cases are rising. Here in New York, there are reports of a four-fold increase since early December in children being hospitalized here in the New York City area. What does that tell you?
Well, we don't know yet whether Omicron affects kids differently, but the reality is so many of our children remain unvaccinated. About only a third of children under 18 are fully vaccinated at this point. And while we know COVID is less severe in our kids, we also know that it's had a real impact in our kids across severe illness and death. And that is why, it's so important for those that are eligible and around, especially our children under 5 who are yet to get the vaccine, to be vaccinated, to really cocoon them, protect them, especially as we're entering this surge.
And I know you mentioned before about the severity of Omicron. What do we know about how severe or less severe Omicron cases are?
We're finally getting good data coming in from different countries. It's showing actually good news, about 50 to 70% lower risk of hospitalization when it comes to Omicron. This is something that, we're excited by because, of course, with this many infections, you'd want a hospitalization risk to be lower. But that still tells us that, with this many cases, we still have this concern. So, yes, there's room to be optimistic about Omicron, but we can't let our guard down as we're entering in these coming weeks.
And Dr. Brownstein, real quickly, why is this variant moving so fast?
It's because of these mutations that is accumulated on the spike protein that increase its transmissibility and immune evasion. And this is why it's spreading, 2 to 3 times faster than the Delta variant. And this is why we have this concern. And of course, now is the time to double down: vaccination, testing, masking, reduce mobility. Let's get through these next few weeks together.
And that social distancing and isolation, all of that. Dr. Brownstein, thank you so much for being with us.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.